Whether you have already chosen your therapist and are preparing for your first session, or you're considering therapy, I know it's a little bit scary to know, what am I really signing up for? What should I expect? Welcome to Therapy Explained, where we explain, demystify, and destigmatize mental health and mental health treatment. My name is Deniss. I'm a licensed marriage and family therapist and your very own mental health cheerleader. For more videos on all things mental health, make sure to subscribe. And if you didn't already know, I make cheat sheets for every video and I make that available to you on Instagram. So make sure that you're following me there to get access to yours. Without further ado, today's video is all about what to expect in a typical therapy session. Let's start with a few disclaimers. Number one is that there are many types of therapists and there are many types of therapies. So I'm going to try to be as general as I possibly can, but keep in mind that if you're going to a particular kind of therapy, it might look a little different. The second disclaimer is that your initial sessions might look different than the rest of your treatment. Now, this does go across the board. Most therapists will conduct an assessment session or sessions. So your first maybe 1 to 3 sessions might look different than the rest of your treatment, regardless of the kind of therapy that you might be going to. But again, I'm going to try to be as broad as possible outside of your assessment sessions. This is what a typical session might look like. Your role in therapy. So regardless of what kind of therapy or therapist you're working with, your role in therapy is an active one. It's important for you to be able to process and reflect on the things that you're sharing in session and to provide your therapist with feedback. You have a voice in your session. You have a voice in your treatment overall. So if there's something that you don't like, something that you want to try, or something that you've tried and doesn't work, let your therapist know. In general, we really love feedback, and the only way to improve your treatment is to get information about what's working and what isn't. Some therapies might be a little bit more directive in that your therapist will tell you what to do. For example, in EMDR, there isn't too much talking. It's a lot more behavioral than a completely psychoanalytical session, for example. So your role in how active you can be in therapy might depend on the kind of therapy that you're doing, but no matter what, you do have a say and feedback is always helpful. What is your therapist's role? Regardless of the kind of therapy and the kind of therapist that you are working with, your therapist's role in the session is to provide support and to provide guidance. We do a lot of reflections and we try to keep in mind what your goals are in therapy and try to get you there using different types of interventions, again, depending on the kind of therapy that you might be engaging in. But your therapist is never going to give you advice and it's never going to be directive in the way that they'll say, here, do this, this, and this, and everything will be fixed and you're done. It's not prescriptive in that way. But some therapists do assign homework to encourage you to practice the things that you're learning in session outside of session. But again, your therapist doesn't exactly tell you what to do in that sense. They really will encourage you to practice things, learn things, and become more independent and confident in dealing with things on your own, which is why it's more supportive and guidance. One of my favorite ways to describe the relationship in therapy with your therapist is more like Google Maps. You put in where you are, you put in where you want to go, and then we give you different options. All the different routes and traffic lights and traffic stops and traffic accidents. As much as we can, we provide you with the information about what to look out for. But at the end of the day, you can always take a detour, or sometimes something happens that we didn't expect to happen and we have to reroute. And that's what a therapist does. It's more like, hey, this could be a good way to go, or you could go this way. What is your role after session? What you do after session is completely up to you. Some people find it helpful to take a break from what just happened, particularly if it was a heavy situation in which you cried or talked about things that were particularly painful for you. So taking a break would be helpful, trying to go spend time with someone that you feel safe with, or engage in an activity that feels soothing to you, whether that's like reading or taking a bath, whatever coping skill helps you. But other people find it helpful to reflect, to start to journal, to write down some things that they learned about themselves in their session so that they can take that with them whenever they want to revisit it. Now, it's totally up to you, but I think it is important for you to still practice some sort of reflection after your session, whether that's directly after or a few hours or maybe even a few days afterwards. Reflect on your session and the things that you learned and try to put into practice some of those things. I strongly believe in that practice makes progress. So the only way to see the changes that you want to see is to implement some of the things that you're learning in therapy. It also will help you to that first point of providing your therapist with feedback. If you talk about a certain intervention or a coping skill and you don't try it, we'll probably just keep talking about it until you do try it, and then we will know whether it works or it doesn't. If it works, great, and if it doesn't, what's important is for us to know that so that we can stop recommending it and so that we can stop suggesting it and maybe explore other things that will be helpful for you. So practicing can be extremely important in helping you make progress towards something. It gives us information. Other things to expect from a session. Sessions will typically run anywhere from 45 to 60 minutes. Now, this is a standard therapy session. Some people will go over if something has come up for you in session and it's too premature to try to close it. If the therapist has time, we'll make more time to help you feel more grounded. Sometimes there isn't too much to talk about, or you want to end session early, and you absolutely can. Now, there are shorter sessions that are offered, and that typically goes for someone who's younger or who has a hard time sitting still. But in general, your sessions should be somewhere between 45 minutes to 60 minutes. Again, remember, this is an exception to assessment. Assessment sessions can run anywhere from 50 minutes to an hour and a half, and can be up to like 3 separate hour-and-a-half sessions. So outside of your assessment sessions, 45 minutes to 60 minutes is pretty typical. You should also expect to be the one doing most of the talking. Like I mentioned earlier, your therapist will provide you with feedback, they will reflect things, they will make observations, probably even provide you with some psychoeducation and information about intervention or mental health, or help you make connections. But the only way that we can provide you with all of those things is to get to know you, to know what's happened for you throughout the week, or about a relationship that you're currently struggling with. So whatever's coming up for you, the only way for us to help you is to know about it. And the best way for us to know about it is for you to tell us. So you should expect that you're probably going to do most of the talking in session. So I hope that all of that information was helpful for you. I know it can be a little anxiety inducing to go into something that you've never done before. Don't know what to expect. What are you supposed to say? Is there such a thing as like oversharing in therapy? By the way, the answer is no. So I hope that knowing though these answers can help reduce a little bit of that anxiety as you're going into treatment, or maybe as you're trying to figure out if you want to go to therapy. I hope this video helped give you some of the information that you're looking for. If you enjoyed it, remember to give it a thumbs up. If you want more videos like this, subscribe. And for your cheat sheet, make sure to hop on over to Instagram. But before you do, please give this video some love in any way that feels authentic to you. Thank you so much for watching, and remember, as always, I'm cheering for you.